Hi, my name is Dr. Eric Pulver. I'm an oral and maxillofacial surgeon, and I'm excited to be here to share an expert tip. What I wanted to talk about briefly was critical analysis and a thought process. And I think that sometimes, especially those of us that have been in practice for quite some time, are used to doing things because it feels right. You know, and you have that gut feeling and we have that intuition. And we have good outcomes that we've watched over the years, and we see that things work. But sometimes that can be a bit of a trick and come back at you. And I think that all of us, especially those of us at the Seattle Study Club, you know, the University Without Walls, we're all challenging each other and we're seeing what people are doing, kind of out at the limits and some amazing things. We often will go back and do the things that we're used to doing because they work, use the products we're used to working with because they work, and I think that that's great. But I think that when you critically analyze what you're doing, you're less likely to fall into a trap of doing things and falling into you don't know what you don't know. So it's good. And I think that if you continually look and say, is that the best I can do for my patients? Is that the best care that I can offer? Sometimes, even if you disagree with an article you read or a speaker that you heard, if you can really look at it, sometimes they're onto something and they're a little bit ahead of what you're doing. And it's a good thing. And I think human nature often says, well, what I'm doing is good and I'm the best and it works really well. And I think being open to, wow, maybe that person that has written a tremendous amount of books and knows what's going on, and they changed what they're doing for a reason. And if you can look at that and critically analyze it, and you might want to implement it in your practice. So I think that we're constantly learning and evolving and changing. And I think that at the end of the day, you know, our patients benefit from that. So I think that we shouldn't be complacent in doing things that work great, because excellence is just one step away. And it's something that I think we all, especially in the Seattle Study Club, strive to be. And you know, critical analysis, I think, is super important, and that's my message. Don't stop doing it.